Hello, everyone, and welcome to the Voices of Forestry podcast. I'm your host, Seth Stevenson, the communications coordinator with the Arkansas Forestry Association. And today we're going to be talking about something that's probably a little more of has a broad interest to people, not just in the forestry industry, but people who enjoy spending time outdoors. We're going to be talking about tick-borne diseases, just things that you might need to know, and what those may be and what they may do to you if you come into contact with them. But before we do that, let me thank our sponsors this month, Shelby Taylor Trucking, for their support of the show. We're going to hear a little bit more from them later on in this episode. But for now, let me introduce my guest this month. It is Dr. Laura Rothfeld, the State Public Health Veterinarian with the Arkansas Department of Health. Dr. Rothfeld, thank you for joining me today.
Thanks for having me.
Now, you've kind of, we had a little bit of a disconnect because you had a surgery, so you're in the comfort of your own home, and you're joining me by Zoom today. But I just wanted to say thank you for taking the time out of your recovery, during your recovery, to sit down and kind of help us through this. Your name was tossed to us a couple times as the best person to talk to about tick-borne diseases.
Yes, thank you. I think that this is fantastic that I can work from the recliner. And
The beauties of modern technology, right?
yes, exactly.
Well, Dr. Rothfeld, if you could, since you are a new guest here, can you just kind of give us a brief history of who you are in your professional history and how you got to be the state public health veterinarian?
Yeah, sure. So I am actually an Oklahoma resident, so just next door. I grew up there and I went to veterinary school there. I graduated in about 25 years ago. And I actually was a private practitioner, so I worked in rural Oklahoma where we had quite a few ticks, of course. And I did that for a couple years, and 9/11 happened. Everybody should be familiar with that. And at that point, I needed a change in career. And so I actually ended up joining the U.S. Army, and I was a U.S. Army Veterinary Corps officer. I did that for many years where I served both active duty and in the reserves, and actually was an Army civilian for a period of time as well, doing veterinary work. And a lot of people don't know that veterinarians are in the Army. And yeah, they're a little small but mighty group of fantastic people with vet techs and food inspectors and things like that. So during my time in the Army, I actually then at one point became assigned to the Centers for Disease Control and Prevention, so CDC, for as an Epidemic Intelligence Service Officer. So another acronym, EIS. That's a 2-year fellowship program where people can, veterinarians, physicians, anybody interested in healthcare, public health with a doctorate degree can apply. And then you get applied epidemiology um, experience. And so during that time, I got assigned to the Arkansas Department of Health. I was actually in Germany with the Army at the time, but then I moved to Arkansas. Quite a difference in habitats,
Mm-hmm.
temperatures, and climate, and all that stuff. But anyway, so I wanted to get a little closer to home, so it worked out. I got right next door to Oklahoma. And while I was in that fellowship with the Arkansas Department of Health, I also was deployed to Sierra Leone for the Ebola outbreak response. So that was very interesting time doing some epidemiology work for that outbreak, trying to contain it and prevent additional infections. Um, I then had to go back to the Army after my 2 years in Arkansas. So I went back to the Army and ended up with a medical retirement with my back, which is what I just recently had another surgery, my fourth surgery on. And the uh, former state public health veterinarian was retiring from Arkansas. And so actually they reached out to me and asked if I was interested in the position. Apparently I did a good enough job making an impression. And hadn't burned any bridges. And so they reached out and I thought, this is great timing. You know, I'm leaving the Army and I love doing public health work. And so I ended up coming back here in 2018 and I've been here ever since. So this is my, if I can do the math right, my 7th year with the Arkansas Department of Health.
Okay.
And
Awesome.
with the Department of Health, we um, look at zoonotic. So I'm responsible for zoonotic disease, which includes vector-borne diseases. And vectors just mean that it's a pathogen, a disease agent that passes through something into like an animal into something else. So, and that's what brings us to tick-borne diseases is
Okay.
ticks or vectors, and then also mosquitoes. So, yeah. So we do the surveillance for the entire state of Arkansas.
Okay. Awesome. Awesome. Yeah, I was about to ask too, just to, again, for my, I told you I kind of learn in these episodes what
Yeah.
exactly the difference was between the state public health veterinarian and the state veterinarian, kind of what the difference is. What is it that you do kind of on a daily basis? Can you kind of just describe that for
Yeah,
us?
sure. So yeah, I get confused often with the state veterinarian. They're with Department of Agriculture, and they are
Hmm.
actually they work on mostly like livestock diseases, and they're regulatory. They have a regulatory function, and so they work with the poultry industry, the beef industry, the pork industry. They do a little bit with some other animals, but that's pretty much their focus. And then my focus at the public health agency is on people. So it's really interesting because I'm a veterinarian by background and training, but I have this applied public health training where now I'm actually working at the interface, and we call this One Health, which is the interface between people, animals, and the environment. That's the
Okay.
triad of One Health. And so um, instead of really focusing on the diseases in the animals, I'm looking at the diseases that can pass from animals to people, and animals meaning ticks and mosquitoes too, but also things like rabies from mammals in our state,
Hmm.
from skunks and bats, and a variety of other infectious diseases. In fact, there's, over 60%, two-thirds of infectious diseases in people are what's considered zoonotic, can come from animals.
Okay.
So,
All right. That clears up a lot because that word veterinarian in your title really kind of throws, or probably throws people for a loop like it did me when you told me a couple minutes ago. So, okay,
yes.
great.
Hmm.
Um, so, Dr. Rothfeld, can you just kind of describe? I mean, we're in Arkansas. We're an outdoor state. We're the natural state. We have our forestry folks that are out in the woods every single day, but then there are people who are out in the woods for recreational purposes as well. How big of a problem or an issue are tick-borne diseases here in the state of Arkansas?
Yeah, so Arkansas being the natural state, as you mentioned, is we also have a natural population of ticks that love to feed on us. So we are considered a state that does have a lot of tick-borne disease. And I say this sort of with the caveat that we're going to talk about this in just a minute about the different kinds of tick-borne diseases,
Hmm.
but we're gonna talk about it in a separate thread of like you consider Lyme disease, which is not considered to be highly endemic in Arkansas. Those infections in the regions where they are highly endemic, which would be the upper Midwest region, so think Michigan, Wisconsin, Minnesota, and then the Northeast, New England area where it's very heavily concentrated there. There's a thousands and thousands and thousands of cases of Lyme disease. So if you eliminate Lyme disease though out and you look at all the other tick-borne diseases, then Arkansas typically ranks in the top five for the all other tick-borne diseases.
Hmm.
So we are, we do have um, an increased prevalence in our ticks here, and people also a lot of outdoors and a lot of people being exposed.
So, has there been an increase in those numbers, or is it just for the simple fact that we are a heavily outdoor recreational type of state? It's just kind of who we are, and because of that, we have more people out in the woods, in nature, coming into contact with ticks.
I think it's a combination of both. I also think it's a combination of increased testing, increased awareness by
Hmm.
providers for testing for it, um, and also changing in climate. And maybe there's an increase in outdoor activity along with increased seasonality of when ticks are emerging because, they go into this diapause over the winter, but if the temperatures at least our ticks here in Arkansas, but if the temperatures will warm up as they do sometimes in the winter, then you have an added sort of exposure time frame um, during that season. So I think it's a combination of a lot of different factors. I can't say that we're having this huge increase in tick-borne diseases, um, but I definitely think, and there are some graphs that will show you that over time, there's this steady increase in diagnosis. Now we're also finding newer tick-borne diseases we have new technology, right? We have all
Hmm.
these new systems that laboratories can do, all these new testing methods. And so we're finding diseases that we weren't even aware of. And so I think that that's contributing as well as our increasing body of knowledge.
Well, let's kind of hop into that. You mentioned Lyme disease, which I think if you talked about tick-borne diseases to just someone out in the street, Joe Blow, Lyme disease probably is one that they're well aware or they're aware of more. Like, I
Yep.
feel like that's maybe the more
Hmm.
common one. But what are
Hmm.
some of the diseases? I know alpha gal is one that we've experienced. We have a couple folks in our industry that have received alpha gal from a tick. What are some of the more common tick-borne diseases here in the state? You said Lyme disease is really kind of more concentrated elsewhere, but what are we experiencing here in Arkansas?
Yeah, so a lot of people look at our state maps, which you can find on like CDC, and then we've now got some interactive dashboard maps on the Arkansas Department of Health website. But if you look at that, then over the years, we were, like I said, in sort of the top five for Rocky Mountain spotted fever, which people may have heard of that disease. Now that I've said with these new lab test methods and things that we're finding out that we probably don't have the same agent or the same bacteria that causes true Rocky Mountain spotted fever, but we have other things called spotted fever rickettsiosis. Rickettsia meaning the name of that type of bacteria. So there are maybe a group of rickettsias that cause very similar um, symptoms as Rocky Mountain spotted fever, but a little bit different here in Arkansas. And then there's what we really do have is Ehrlichia, so Ehrlichiosis. And there's two different species that we're aware of right now, one of which was named after Fort Chaffee in Arkansas. So it's Ehrlichia chaffiensis. So Arkansas's fame, claim to fame is got a tick-borne disease named after, a spot here in Arkansas. And then Ehrlichia ewingi, which was actually named after Sidney Ewing, who was one of my professors at Oklahoma State, which I think is great. So I have a true connection to Ehrlichia because there's another one called Ehrlichia canis, which affects dogs.
Mm-hmm.
Um, and I had a dog that had severe disease with that as well. So, and of course saw that in clinic. But so ehrlichiosis, I think, is one of the more common ones we have here. And all of these, well, and then let me mention we have tularemia. So tularemia is something that in the past was called rabbit fever,
Mm-hmm.
and it was because hunters hunting rabbits um, would be infected by the rabbits being sort of a type of a vector of this disease, although they do get sick from it. So maybe more of a mini reservoir. But then this bacteria is also found in ticks in our state. And so here in Arkansas, tularemia, we see a lot of tick-borne cases where people become infected with this tularemia bacteria. And it's a little bit different. So I guess let me go into the symptoms of these
Mm-hmm.
diseases. So the majority is we call it the summer flu because it's typically during the warmer weather we get an increase. So you can think of like a hill, and if you look at from January to December, it starts to increase up, going up the hill, and then to the top, sort of middle of the summer, and then down, kind of down. And that's what we would call an epi curve. So by month, how many cases. Um, and so these diseases, they look like the summer flu because people get a fever, maybe. They don't always have to have a fever, but there could be a fever. There may or may not be a rash of some sort, a little bit different. All of them have different types of rashes, different than Lyme. And then muscle aches, chills, and just not feeling good at all. Headaches,
Mm-hmm.
sometimes nausea and vomiting. So it could be it's very generic, but yet sometimes people can get very, very sick and will be hospitalized. And even it's a very, very small percentage that can be fatal, especially if not treated. So when I'm talking about these bacteria, there is treatment for that. So
Okay.
there's antibiotics that can be given. Um, and then tularemia is a little bit different. It's the one that causes really enlarged lymph nodes. That can even ulcerate. So you can have, I mean, like softball sized
Oh, wow.
lumps. They can get very big, very large,
Mm-hmm.
and become ulcerated as well with tularemia. So, and I have to also mention that we're finding viruses now as well. So there's something called Heartland virus. Um, which was identified in Missouri. So, and then bourbon virus, which was identified in Bourbon County, Kansas. There's actually Bourbon County, Kansas. And so those two viruses have been found in patients. A couple of patients here in Arkansas have been infected, and also in our ticks, when we've done some tick studies, the CDC has identified those viruses from some of the ticks that we've collected. So, like I said, we're learning every day
Mm-hmm.
about new things.
Okay. Well, I'll tell you what, Dr. Rothfeld, let's take a brief pause before we talk into, kind of some tips that the Department of Health kind of recommends to folks who are going outside and maybe encountering ticks. We're going to take a brief pause here and hear a little bit more from our sponsors this month, Shelby Taylor Trucking.
Shelby Taylor Trucking serves all your timberland needs in South Central Arkansas. With over 50 years in the industry, Shelby Taylor Trucking has established themselves as trustworthy leaders in the industry. From planting to harvesting to hauling your timber, Shelby Taylor Trucking is ready to serve you. Follow them on all social media platforms at Shelby Taylor Trucking. Learn more by visiting their website at staylortrucking.com. That's staylortrucking.com.
Thank you again to Shelby Taylor Trucking. So, Dr. Rothfeld, we've talked about some of the different kinds of tick-borne diseases that are out there, and some of the symptoms that can occur if you may have something like this. So, can we talk about just what are the general tips? I guess if you do start to see these symptoms, what do people need to do?
Yeah, so we handle things a little bit differently for these tick-borne diseases than I would say like in the Lyme endemic areas. And so we get these questions all the time about, I've been bitten by a tick, what should I do? Um, the the first thing is it's a good idea just to keep the tick, or at least take a very good photo, not a blurry photo of the tick if you can. And then that way, and just hold on to it, because if you've been bitten, there's a very small chance that you're going to become ill. So this isn't like every tick out there is carrying these diseases. This is like 1% of the ticks, and that's not
Hmm.
like a quote of data, but the variety of, um, you know, that sort of the average of percentage of ticks that are probably infected is very, very low. And so a lot of times, people get bitten by ticks. Now, the other thing is that you could be bitten with one that has the pathogen in it, but your immune system, for whatever reason, is able to fight that infection off and kill, and not
Hmm.
allow that infection to persist in your body. Unfortunately, some people in some situations get infected with this bacteria, and they do develop these symptoms. And at that point, and typically I will say that's between a few days to up to 3 weeks
Okay.
after the tick bite. Um, so during that time frame, if somebody starts to feel like they're not feeling well, then they need to go seek, care with their healthcare provider, their primary care provider, and just let them know, hey, I have been bitten by a tick. There may be a connection. That doesn't mean
Hmm.
there is a connection, So then the provider will evaluate the symptoms and see if they're compatible with the tick-borne disease. If so, then they probably will start them on an antibiotic. Typically, it's a doxycycline. If And then they'll hopefully, we'll run some lab tests, take a blood sample, and run some laboratory tests just to kind of confirm that diagnosis.
Hmm.
Now, I mentioned those bacteria are typically susceptible to first line antibiotic. And sometimes they might need something a little stronger, with tularemia. Sometimes they need a different antibiotic, but with the viruses, unfortunately. So we've seen patients who they clearly look like they've got a tick-borne disease, but they're not becoming better, because usually with this antibiotic, you get better within a day or two of starting it,
Oh,
with
okay.
these
Wow.
diseases. So it's pretty fast.
Hmm.
But if you're not getting better, then there's the possibility that maybe you were infected with one of these viruses. And so viruses don't respond to the same medications as bacteria do. And so they um, usually that's just supportive symptomatic care. And if, if you may end up being hospitalized with that virus, you may not. And so we think that that virus is really underdiagnosed because number one, there isn't a commercial test for it. So you have to test for
Hmm.
these viruses I mentioned at the CDC. So providers, healthcare providers need to have that sort of suspicion and want to go that extra step to send that sample to us to get to CDC for that testing. And we do encourage providers to do that because it helps us inform the public, right? And
Hmm.
healthcare providers of what's going out there. So we encourage providers to do that extra step. There's no extra cost, to us or to them for doing that viral testing. Um, but yeah, so we do recommend that, if you're feeling symptomatic, that you do go seek treatment. There are some companies out there, not I'm not aware of any in Arkansas that will test the tick, particularly for these pathogens. There are some research studies, like we did one where we tested 6,000 ticks from Southeast Arkansas just recently. We're still evaluating those and analyzing those symptoms. But we published a paper on another
Hmm.
6,000 ticks that we did from Northwest Arkansas. Um, and that just came out this past year in 2024. Maybe it was early 2025, um, on those results as far as what's in these ticks. But on an individual basis, if you look at just testing the tick that bit you, it's really hard to analyze that because, like I said, you may identify something inside that tick, but that doesn't mean that either it fed for long enough to transmit it, because with the bacteria, some of them have to feed for longer than 24 hours. Even
Okay.
Lyme disease, they say it takes up to 36 hours or longer for that spirochete bacteria to get transmitted. With the viruses, though, they say it can take 15 minutes of feeding.
Mm.
So there's a different timeline. So there's a lot of factors involved there. So if you could be bitten, you may not get that disease, passed into you, or that pathogen, sorry, for scientific terms, get passed into you, causing disease. Your body, your own innate immune system may fight that off. You may not become ill. You may test the tick and it's negative for these pathogens, but that's because it's all been injected inside you. So then you look and
Mm.
you say, oh, this tick had nothing, and you feel better, but then you get sick. So testing an individual tick is a little bit confusing, but there are a lot of places out there that you can send your ticks to get them tested if you still want to just do that and are curious about it.
Okay.
That's fine too.
Well, and so I'm going to take a little bit of a detour here.
Sure.
So when I guess how do you guys get contacted? Is it whenever a doctor or whomever confirms that it is a tick-borne disease, do they just report that to the Department of Health for your records, or how does that kind of relationship work?
Yeah. So the diseases that we are studying are ones that are called reportable diseases. So there's a mandatory reporting law in Arkansas for a specified number of diseases, everything from sexually transmitted diseases to vaccine preventable, pertussis, chickenpox, that kind of stuff, measles.
Mm-hmm.
Um, all of those are on a list, and they're on our website as far as what is reportable in the state of Arkansas. And every state has their own sort of reportable disease list. They mostly correspond to each other as far as what then becomes nationally notifiable, which is not mandatory, but is recommended to be reported to the CDC. So on that list, we have a list of these tick-borne diseases that, a group of people come together and approve, and then the Board of Health like goes and approves that, and then it gets sent to the Public Health Committee um, with the legislators, and they determine like what should be reported. And
Mm-hmm.
so what we have reported in our state are those tick-borne diseases that we're doing that surveillance on, that we um, put that data out on our website. And so what happens is laboratories that end up testing and they meet a certain test parameter for this pathogen will then trigger them to send the lab report to us.
Gotcha. Okay.
Also, if a healthcare provider, so we're called like dual reporting states. So even the healthcare provider, if they suspect it, they're supposed to be reporting that to us. So we should get a report from the healthcare provider and the lab, but typically it's mostly just the labs that come in.
Okay.
So a lab report comes in, and then that triggers an investigation. And what that means is a positive or a reactive lab report doesn't always mean that that's the true cause of illness in this person. So there's always this investigation that goes into that, and not to get into too many details, but there's standardized case definitions that all the states try to use, and it includes laboratory test result and clinical symptoms, and and what the presentation looks like in the patient. And you have to combine those two, and they have to meet certain parameters on both sides to say, yes, this is truly what's causing this patient's illness, or this is what we presume to be causing, because
Mm-hmm.
there's some that are confirmed. Like if you culture tularemia out of patient's blood, then that is most likely the cause of that, because it shouldn't be there.
Mm-hmm.
And so if the symptoms are compatible, then that's most likely the cause. But then some of the tests are antibody tests. And this is what we're finding now with Rocky Mountain spotted fever, is that for many, many years, Arkansas was like the top for Rocky Mountain spotted fever cases. But a lot of it was a very, very low antibody titer. And this sort of body of public health came together, and they said, hey, we think this is some background going on, and like I said, like you could be infected, you may develop this immune response, and then you have high antibody levels to them,
Mm-hmm.
and then those can get detected for years out. So in those cases, just because they sort of met this, they've got an antibody, doesn't mean that they were sick,
Gotcha.
from
Okay.
that disease. So we do these investigations, and like I said, I mean, this goes into, like, we have to look at the medical records for these patients or interview the patient and find out,
Mm-hmm.
how were they feeling, what was going on, what did their other blood levels look like, um do this whole, it's detective work. So, and like I mentioned, epidemic intelligence service previously, those are called like sort of the disease detectives, right? So
Mm-hmm.
when I was in that EIS program, um there's a film with Kate Winslet, Contagion. She was an EIS officer, a disease
Mm-hmm.
detective. And so those are the people that kind of go out at the beginning of a new, like, what is this that's making people sick or killing people? And they go out and do this detective work and, figure out what's going on. And
Okay.
that's really what we do on a daily basis at the health department.
Okay. All right. Sorry. Thank you for kind of letting me go down that rabbit hole a little bit.
Sure.
Just that popped into my head. So let's kind of bring it back to some tick tips, if you will.
Hmm.
Does the Department of Health have any recommendations to removing ticks? I know growing up, I mean, you just rip them off, and then you were
Yeah.
told to, I think, burn them off at one point, but
Yeah.
I don't know if those are wives' tales or what. So is there like an official Arkansas Department of Health, this is how you remove it?
Yeah. Yeah, no, I remember it was, you light the match, and then you blow the match out, and then you stick the match, the hot like end of the
Mm-hmm.
match, to the tick's butt, and he's
Mm-hmm.
supposed to, like, he or she is supposed to, like, release. Yeah, that was when I was growing up too. So, yeah, it is habit to just reach down and grab the tick and pull it off. And in all honesty, that's probably fine if that's all you've got. But we do recommend using tweezers, fine tip tweezers, to like grab and hold, because the potential of, squeezing some of those contacts out. Also, squeezing the tick may inject more stuff in as you remove the
Mm-hmm.
tick. So we recommend grabbing by the very base. Some people call it the head of the tick. The head is really, or there's some mouth parts that are, um, to not be graphic, but they basically saw into your into
Mm-hmm.
your skin, right? So they're sawing into your skin, and then they secrete this little cement and some anticoagulants to make your blood so it doesn't clot, so they can, kind of suck the blood, and some painkillers even. So, a bunch of things kind of get injected as well. Anyway, so you grab the as close as you can to the skin level to try to pull that out without squeezing the belly of the tick, to inject anything in. And then you just pull
Mm-hmm.
straight out. Don't twist. You just pull straight out at a 90 degrees. And we've got some diagrams on that. You can find that on the internet as
Okay.
well. We've got what we call tick removal kits that we're now giving out at outreach events, and I can send
Okay.
you some actually, if that would be you know ideal. Or we can, I don't know where you're even located
Yeah, so
actually.
no, we're just like 2 blocks from the Capitol. So we're
Oh,
we're super close to the Capitol is where our office is located.
great.
So
Yeah,
yeah.
so we could bring you some, like, yeah, tick removal kits you could give
Yeah.
out to your constituents or whatever. But
Yeah, for sure.
They're little pouches. I think they're
Hmm.
really cute. They're little red pouches, and they've got little tweezers with a little magnifying glass, so you can kind of
Hmm.
see the tick and see down close, and you can remove the tick that way. They got a little baggie in there, a little antiseptic, got a little wipe for which we haven't talked about, but insect repellent and some things like that to like
Okay.
help to remove the ticks. So yeah, so I can get some of those to you as well.
Yeah, for sure. And we can talk about that here
Yeah.
before we end for the day. But no, yeah, that's great. So it's not a whole surgical procedure or MacGyver-esque lighting that match and
No,
blowing on it type of thing. Okay, good. Well, Dr.
please
Rothfeld,
don't burn yourself up.
no, please, yeah.
Yes.
So we're kind of getting here towards the end of the episode. But one thing I did want to kind of talk about with you is, do you have any tips? Are there any tips that the Department of Health has for folks who are either working in the forests or in the woods, or people who are just going out to enjoy recreationally?
Yeah, yeah, no, we definitely have some tips. So, growing up, you may have been the same way too. We didn't use anything.
Mm-mm.
Ticks were a part of life, right? They
Mm-hmm.
were just, and I know a lot of people that have never even seen a tick in their lifetime. So there are some people who never get off the concrete. Um, and so when we go to some of these events, we bring these ticks out to show them and let them know what they look like. But yeah, so we definitely recommend several things. So let's start with clothing. So with clothing, it's best to wear some light colored clothing so you can kind of see them crawling on you.
Mm-hmm.
We recommend tucking your socks into your pants so you look really cool. That's the cool way to go now, right? Tuck
Mm-hmm.
your pants in your socks. And when I say that, people are like, well, I'm wearing shorts. And that's probably but if you're wearing pants, tuck your pants into your socks, and then that kind of eliminates them. So let me back up. So the ticks are
Okay.
actually where they're found is in dense vegetation, leaf litter,
Mm-hmm.
tall grasses. And so what they're doing is they're just kind of hanging out there, waiting for an animal to come by, or some of them are very aggressive, like our Lone Star tick here, which is the most common tick we see. Some of them are so aggressive that they can kind of sniff out or smell out with these sensory organs your CO2 as you're breathing.
Mm.
So hold your breath, but don't hold it for too long as you got. No. But yeah, so they can kind of sort of chase you if you want to say that. But they'll come find you if you're just sitting in a grassy area, they may come and find you. And actually that's one of the trapping methods is to set out a container of dry ice, which offsets CO2, which is carbon dioxide, which is what you
Mm-hmm.
breathe out. And so it attracts the ticks into that trap. So that's one of the trapping methods. So if you want to be a
Interesting.
trap, you can just set out in the grass and wait and see, and they'll start to come. Um, but yeah, let me see, let me go back up. Okay, so you want to kind of stay um, off of the grassy leaf litter area. So if you're walking in the trails and stuff, but I know that some people can't do that. So if you can't do that, then you want to treat your clothing with permethrin. Permethrin is very effective at killing them, and it actually will last for several washings as well. And
Okay.
then there's some clothing at some of these outdoor stores at Bass Pro and REI and places will make some clothing that's actually permethrin treated. In the Army, our uniforms came brand new permethrin treated with insect guard in them. And so they would be good for like 35 washings or something. But yeah, so you can use that kind of clothing. You can spray your shoes. Another tip when I talked about tucking your pants into your socks is you can actually put duct tape inside out around your
Mm-hmm.
ankle. And that way that when the ticks are crawling up, they get stuck on the duct tape and then you can take the duct tape off later. That's really fun if you step into what we call a tick bomb. And a tick bomb is a clutch of larvae. So where the mama tick had laid her baby eggs,
Mm-hmm.
and then they all hatch at the same time, they're kind of all hanging out in the same spot. And if you step in that area, you can get thousands of little baby ticks
Oh
crawling up you.
gosh.
It's terrifying, but many of us have experienced that. And they're so tiny you can't see them. That's the ones that people call seed ticks.
Okay.
Those are
Yeah.
actually
Mm-hmm.
larvae, yeah. They're actually they're six-legged versus like when they go to nymph and then to an adult, they actually grow their extra pair of legs and they become eight-legged. But I digress. So let's get back. So you want to, treat your clothing and also use EPA registered insect repellents. And you can look on the CDC website or the Arkansas Department of Health. We've, got some recommendations there. which include things like DEET, which has been, I mean, over 50 years proven history of being safe and effective. Um, and then things like picaridin. There's even some essential oils that may be effective that are listed in that. And then also when you're done, so we know people and we encourage people to go outdoors and do recreational activities outdoors. We don't want you to shy away from that. Or if you're required to work in that environment as well.
Mm-hmm.
But we want you to be aware that when you come inside, you should then remove the clothing that you're wearing from the outdoors as soon as you can and either throw them into the wash or the dryer on high heat. And then take a shower within a couple hours so that you can rinse off any of those ticks that are crawling on you. That's the best recommendations that we have. And do a tick check, especially
Mm-hmm.
the next day, do a tick check and see on your body if you have any so you can remove them before they become engorged.
Okay. Yeah, that's usually when we do like a tree farm tour or anything like that. That's the first thing my wife makes sure I do is a tick check, get those clothes in the wash, all that good stuff.
Yeah.
So she's on top of it for sure. So, well, Dr. Rothfeld, this has all been great information. I'm learning stuff as I do these episodes, and so, is there anything else though
hmm
that we may not have talked about, or anything you want to add before we send us packing?
Yeah, sure. So, um, the last thing I want to say is that you want to treat your pets. So I want to
Mm-hmm.
bring it
Yes.
back to my original training, which is as a veterinarian.
Mm-hmm.
And I want you to treat your pets or any animals that you're around, even, your cattle and horses, they can become very infected with ticks or infested, I should say, with ticks and get some tick-borne diseases as well. And also, not only will you protect them from tick-borne disease, you will protect yourself because a lot of ways that people get infected is not by doing outdoor recreation, but by letting their pets come and sleep in their bed. So their
Mm-hmm.
pets are going outdoors to use the potty, to do whatever it is that they're doing, and they may get a hitchhiker. And this little hitchhiker then comes in on their fur and then you know you take them to bed with you or you sit on the couch with them or whatever and that little hitchhiker's crawling around trying to find the best spot or where's my best meal for dining tonight and they decide that it's you instead of the dog or the cat or whatever. And so yeah, this is also truly one health where you treat your pets, you treat yourself, or you
Mm-hmm.
prevent disease in your pets. You can also prevent it um, in yourself and in people. So I think that's an important point to remember. And let me go back to I did want to mention on ticks, and I didn't
Mm-hmm.
talk about tick species or anything like that in this talk. I'm aware of it enough, but I'm not the tick um, expert per se as
Mm-hmm.
far as like all of that goes. But I know which ticks cause which or carry which diseases and which ones we have the most of here and things like that. But I do want to mention that this is one of the scary story parts. We have a new tick in town. It's called the Asian
Okay.
longhorn tick. So it's different than the Lone Star tick. And sorry, I didn't send this information to you
No,
beforehand, but
it's
I
fine.
think I need to mention it. Yeah. It's been found in about, I think it's 7 or 8 counties here in Arkansas, really in the northern part of the state so far. And this tick, as in the name that says Asian, it originated over in Japan and Eastern Asia. And in 2017 was first identified in the United States, actually on a sheep in New Jersey. By 2018, we had found it here in Arkansas,
Mm.
and since then we've been slowly finding it here. It's not nearly This tick isn't becoming nearly as established as it is over the northeastern part of the United States, where they're finding it by the thousands when they go out and look for it. We're finding it in much smaller volumes, and whether that means maybe we have more Lone Star ticks, which are a little bit more aggressive, and maybe they're, I don't know, I'm speculating here, but out competing this longhorn tick or something. Anyways, the fascinating thing about this tick is that it can procreate or reproduce without a male. In fact, there's only been one
Interesting.
male of this tick found so far in the entire United States.
Wow.
One male tick. Everything else has been female or nymphs, or yeah, which are they don't really have a gender or sex, male and female until they become an adult. So they're finding larvae and nymphs and females. And so those ticks can lay an exorbitant amount of eggs and have multiple stages of ticks on an animal. And We aren't aware of any diseases being passed yet from those ticks here in the United States. It can pass some pretty severe diseases, sorry, in Asia and other countries, but we haven't
Mhm.
identified somebody becoming ill with a particular disease here.
Okay.
Cattle have been infected with a parasite called Theileria with this tick, and that's the only thing that we know of so far. But because it can lay so, it can reproduce so quickly, it can actually, kind of suck the blood out of an animal and cause them to die just from
Hmm.
that. So basically, exsanguination. So
Wow.
that's, yeah, that's the thing of that gives me nightmares.
No, yeah. I mean, when you talk about exsanguination and reproducing without a male host, which is very Jurassic Park esque,
Oh,
talking
yes,
about bringing in another movie,
right.
that is kind of spooky, yeah, for sure. So, well,
Yeah.
does this tick have any like distinct markings, kind of like a Lone Star tick for people to identify, or?
Yeah, it it doesn't. Well, it's a little bit, it looks a little bit different. So you may look at it and say it's different. It's just different. And so if you
Mhm.
see that, or you see an animal that looks like it has a lot of ticks on it, and it just, something's not right about it, we do recommend that you certainly reach out to either University of Arkansas Cooperative Extension has got an entomology program there that can take the tick, and then also you could send pictures to us, and I'll make sure that you have our
Yes.
um,
Hmm.
like our zoonotic email, and we can take a look at the picture, or you could even send the tick to us, and we'd send it off to USDA to identify it to see if that's what it is. So if there's anything unusual, it has a little bit, if you were to see it with intact mouth parts, they look a little bit different than Lone Star tick, but I don't expect anybody to be able to see that. But also, speaking of identifying marks, I do want to point out the Lone Star tick, everybody, is the one that has that white dot on it, but that's
Hmm.
really only the female of that tick. So the
Oh,
male
okay.
Lone Star tick does not have that white dot. It actually has this kind of pretty little pattern on it, but
Hmm.
yeah, it definitely doesn't have the dot. It's only on the female tick. So of
Okay.
that one. And then we have Gulf Coast tick here. We have American dog ticks. Those are the most common ticks that we have here in
Okay.
Arkansas.
All right.
Yeah.
Well, Dr. Rothfeld, is there anything else you'd like to add or you want to say before we wrap this up?
No, I think that's all of our TikTok for
Okay.
today. That's what I
Good.
like to
Hey,
call it.
great. Well, Dr. Rothfeld, again, thank you for taking time out of your healing schedule, if you will, to sit down and talk with us about this. We really appreciate you sitting down and being on the show.
Yes, thank you. And it comes to mind when you were talking about your wife and checking yourself for ticks. I always think of the Brad Paisley song about I want to check you for ticks. So if you've
Yeah.
not heard
Yeah.
it, you have to go listen to it.
Yes. Take some time, go give it a listen, and then,
Yeah.
that you'll be caught
Now
up
you
here.
know.
So, and Contagion, Jurassic Park, just a little bit more
Yes.
research to do. So, all right. Well, Dr.
Correct.
Rothfeld, thank you so much, ma'am. I really appreciate it.
Yes, thank you for having me.
We want to thank you guys for joining us this month. As always, we want to give a special shout out to Rob McCormick / some guy named Rob for the use of our theme song, The Same Love. That's off of his album, The Folkster. We'll have a link to his website in the description of this episode, as always, and you can find his music on Spotify as well. And we want to give another special shout out and thank you to Shelby Taylor Trucking for their continued support of the show. So make sure you come back next month and we'll have a new topic, a new discussion, and a new Voice of Forestry.